Welcome to this week's edition of Senior Talks, an exciting new educational program for those age 45 and older in the Harris County area. Senior Talks features various presentations on opioid use, medication management, recovery, and health. Senior Talk is sponsored by Harris County Area Agency on Aging and the Wellderly program through the Council on Recovery. Today we have Rossana Ishee, older adult specialist for the Wellderly program, here to share some information about barriers to treatment. All right, Rossana, take it away.
Thank you, LaToya, and welcome everyone to another one of our interested and informative senior talks. I'm Rossana Ishee, and I am the older adult specialist for the Wellderly program at the Council on Recovery. In today's topic, barriers to treatment, we will discuss barriers to treatment for substance use and misuse. I'd like to first start off my presentation with addiction and the Thejellinek curve. The Thejellinek curve that you're seeing on the screen shows that addiction is one point on a continuum of substance use, which is known as the Thejellinek curve. And as you can see, there are 6 degrees to substance and alcohol use according to the Thejellinek curve. It starts off with non-use prevention, experimental use, occasional use, harmful use, and the one at the bottom is addiction, which can end up with illness and even death. Then you have the upward swing, which is what we all aim for here at the Council on Recovery, which is recovery. And we do have programs and services that mirror this continuum. Now we will get to the barriers to treatment part of the presentation. As noted in the Thejellinek curve diagram, addiction is a chronic and relapsing disorder characterized by compulsive behaviors, and it is a complex brain disorder as well as a mental illness. For example, one's desires and priorities change. The ability to control impulses is weakened. There's changes in quote unquote normal behaviors, interfering with one's ability to work, go to school, and to have healthy relationships with their friends and family. This is all similar to hallmarks of other mental illnesses. Regardless of the harmful consequences, such as loss of a job, family, friends, self-esteem, and even self-worth, the individual continues using alcohol and or substances. These all play a role on the barriers to treatment. One of the barriers I'd like to talk about today is ageism. Society tends to view older adults through a negative and narrow lens. Negative stereotypes are usually assigned to older adults. These are used to explain away their problems as a normal part of the aging process. In other words, ailments and symptoms are contributed to one being old rather than due to any specific medical, social, or psychological causes. One is quick to use aging as the reason for almost everything happening with an older adult. For example, changes in eating habits are not questioned because older people get fussy about their food. Another example, a change in moods or behaviors is dismissed as one just getting senile or grouchy due to the aging process. Stereotypes of aging in contemporary culture, particularly North America, are mostly negative, depicting later life as a time of ill health, loneliness, dependency, and poor physical and mental functioning. Ageism is echoed in many healthcare providers' belief that older adults' quality of life will not improve even with substance abuse treatment. Even with the best of intentions, ageism does occur. Older substance abusers are seen as not worthy of the effort involved in treating or changing behavior because they are likely to die soon anyway. Another barrier to treatment is a lack of awareness and clinical behavior. Many healthcare and social service providers lack specialized training in identifying and treating mental health and substance use problems in older adults. Many times, a diagnosis of a substance use disorder is overlooked during a routine checkup. These are attributed signs to aging or other conditions. If and when a diagnosis of substance abuse is made, an older patient is less likely to have treatment recommended by their physician and/or their caregiver. Confusion in older adults may be overlooked because home health aides or even family members blame it on a bad night or age-related spaciness. Many individuals, including community members, family, physicians, and society as a whole, still see older adults through a narrow lens. And they have been seeing things in a certain way for so long that they don't recognize it as a lack of awareness. However, it is time for a change in our thinking. Our older adult population is getting older. We are living longer, and there are more of us. Another barrier to treatment I think is very important to talk about today is stigma. Stigma, shame, or denial associated with substance abuse can be related to generation, religion, gender, culture, or a combination of these and other factors. Shame is a common symptom with substance misuse. Many who need treatment will keep silent out of shame. Secrecy, silence, and judgment are part of shame. Individuals get the idea that they are a bad person. Again, the feeling that one is not worthy, focusing on the individual rather than the behavior. Example, if adults attribute their alcohol problems to a breakdown in morals, they may feel shame and are not likely to seek substance abuse treatment. Shame is a powerful negative effect. Many times, what happens is that after one has been consuming alcohol or drugs, the individual may experience negative thoughts, such as guilt or shame. This can trigger even further negative emotions and feelings of hopelessness, which can lead directly to the use of more substances and other coping behaviors, such as self-medicating. In other words, once the so-called party is over, guilt and shame kicks in. The individual feels worse about themselves, and rather than face those emotions, which are painful and difficult, they use again to cope. This becomes a cycle of addiction and shame. Furthermore, relatives of older individuals with substance use disorders, particularly their older adult children, are also ashamed of the problem and choose not to address it. As a result, the substance misuse goes undetected and, as mentioned earlier, can result in the individual not seeking help or treatment. This is very problematic. So shame and stigma are significant barriers to treatment. Rather than reaching out, the individual may go at it alone. Addiction worsens over time, resulting in more shame, and it becomes a cycle of self-destruction. So for today's presentation, we covered ageism, lack of awareness, clinical behavior, and stigma as barriers to treatment. However, it is important to point out that there are other major barriers to treatment, such as cultural factors, discrimination. For example, those who are currently or formerly in the criminal justice system, and/or those with mental health issues, for example. Access to treatment, income, and health insurance coverage just to name a few, are other significant barriers to treatment. The bottom line is that many older adults who need treatment will not seek nor receive treatment for their substance use disorder as a result of these barriers. However, the good news is that there is hope. While we do have our hands full, it is important to know that older adults do as well, if not better, than other age cohorts in treatment. Treatment specific to the needs of older adults tend to have better outcomes. And I like the acronym, if you can see that on your screen, HOPE, hold on, pain ends. And with that, this concludes our presentation. Please stay tuned for our next segment of Senior Talks. And if you have any questions, please feel free to contact us here at the Council on Recovery. The information is on the screen. Thank you so much for tuning in.